Hi YouTube, I'm Dr. Harb, a dermatologist and skin cancer surgeon here in Miami. Welcome back to our channel, where we bring you informative content on various topics. In today's video, we'll be discussing some challenges to the National Medicare program and specifically the Medicare Advantage plans that we have in existence. This is an important topic that affects millions of people and will likely affect you if you live here in the United States. It certainly affects me as a dermatologic surgeon, as many of my patients have Medicare and Medicare Advantage. So if you're curious about what Medicare is and how it works, you've come to the right place, so let's dive in. First things first, what is Medicare? Well, Medicare is a federal health insurance program in the United States that primarily provides coverage for people who are 65 years or older, but also individuals with disabilities such as end-stage kidney disease, regardless of their age. Medicare is divided into 4 different parts, each providing different types of coverage. We have Part A, which mainly provides inpatient or hospital-based care, skilled nursing home care, along with hospice and some home health care services as well. Part B, which usually covers outpatient visits such as doctor's visits, preventative care visits, medical equipment, and even some medical supplies. We have Medicare Part C, and that's also known as the Medicare Advantage part, which allows private insurance companies to offer Medicare-approved plans and provide all the benefits of Part A and B, and often additional benefits such as prescription drug coverage. And finally, we have Medicare Part D, which focuses on prescription drug coverage and helps pay for prescription medications. There has been a substantial growth in the number of Medicare patients who participate in Medicare Advantage plans, or Medicare Part C. Now remember, these are plans that are administered by the insurance company instead of the government. So currently we have about 48%, or nearly half, of all Medicare patients who are on a Medicare Advantage plan. Unfortunately, it is becoming increasingly challenging to provide high quality care to patients with more serious illnesses on these plans. And we're going to talk about why, along with what I think are some pretty good solutions for this from a national perspective. Historically, Medicare Advantage plans have insured patients who were actually healthier than those on traditional plans. However, special needs plans also currently exist, and these are mainly catered towards patients who are eligible for Medicare and Medicaid, along with patients who are in long-term facilities or nursing homes, or patients who have specific illnesses. These Advantage plans have the combined goal of providing high-quality care that is coordinated, competent, equitable, and patient-centered. However, the companies that are in charge of implementing these plans have financial incentives to lower the costs and keep a portion of the savings as profit. So the question is, how does the financial incentives that are presented to these companies to administer these plans, how does it actually affect sick patients on these plans who need routine care, such as wound care, medication adjustments, respiratory support, nursing home visits? Actually, I'll provide you with some references, but some of the committees have even said that they can no longer provide any accurate description of the quality of care in the Medicare Advantage program. Although some insurance companies release data to researchers such as their databases, and we go through them and we try to study them and quickly realize that a lot of the spreadsheets and databases have a lot of missing information. Some of these Advantage plans are helpful for people with serious illnesses because they provide ancillary services such as medical transportation, meals, caretaker support. However, it is very difficult to tell how often these services are actually being delivered to patients, or whether these services are actually improving patient care as a whole. These are questions that us doctors ask on a daily basis that are very difficult to prove on a large scale because reliable data is simply too difficult to obtain or simply missing. One of the biggest issues with the Advantage plans is the Quality Bonus Program. This is a program that is essentially a 5-star rating system that rewards insurance companies with extra money from Medicare for demonstrating high performance. And patients actually rely on these 5-star ratings when they choose their plans. The issue is we don't really know how insurance companies are reporting their data because most of it is actually based on patient surveys. Since the number of patients on these Medicare Advantage plans is projected to grow by another 20% by the end of the decade, it will be best to have a forward-thinking approach and help notify the gaps for patients with serious illnesses, or a lot of these patients could really lose access to high-quality care and high-quality doctors. I hope this video was able to shed some light on some of the nuances we deal with on a daily basis as a physician or patient in the United States. Please leave a comment below and let us know what your thoughts are. As always, like and subscribe to our videos and help YouTube's algorithm spread the work we do to more viewers such as yourself. Thanks for tuning in, and see you later, YouTube.